We are seeing a continued increase in the daily case counts from the coronavirus infection. I'm going to update you on that and also talk about what's happening in nursing homes and in our efforts to distribute a vaccine, and then also the event limits that the mayor just mentioned. So first, the numbers. Since this time yesterday, we've identified 145 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 39,413 since the beginning of the epidemic. And 0 new cases identified as probable cases by rapid tests since yesterday. Now, for the past week that ended last Saturday, October 10th, we averaged 158 cases per day. And of those people tested, 4.5% were positive. Now, those numbers are both higher than the week before, when we averaged 126 cases per day and 4.3% positive. Those numbers are higher than I reported a week ago because there are delayed results that will come in. And the case counts that I'm giving you now for last week will probably likewise increase in the coming days. Where are we seeing this increased spread? We're seeing continued spread in the college campuses in the city, including Temple, Jefferson University, and St. Joseph's University. We're also seeing more spread in the far northeastern part of Philadelphia and in South Philadelphia. Now, most of the cases we're getting these days are occurring in younger adults. In the last few days, it's about 2/3 are people between the ages of 20 and 49. And to the extent that we can find out how it's being spread through our contact tracing interviews, it's occurring within households and at social gatherings. Since this time yesterday, we've identified 0 new deaths. Our total count of deaths since the beginning of the epidemic is 1,830. We're averaging about 15 deaths per week, and the information on deaths tends to come in batches, so we would expect to hear about more later this week. Now, in our nursing homes and other congregate facilities, we are seeing more cases, but still generally fairly small numbers in nursing homes. We would like not to have any, but still generally some numbers, but not large numbers. Now in schools, we have been working with the schools that have been offering in-person education since they opened this fall. And with that work, we have identified 24 sites that have seen cases in students or staff. Some have had more than one case. And 12 of those school sites have initiated some form of quarantine, either on their own or with our advice. But what's very important is that so far we have none of the sites where we have evidence that the infection spread within the school. When we've seen cases in students, we've seen cases in staff, these are people that we believe were infected elsewhere and brought the infection in the school. We can't rule out that any spread occurred in schools, but there's no clear evidence that any spread has occurred within a school building, which I think bodes well for our ability to continue to offer in-person education in schools. Just an update on testing. We have information on our fixed sites where testing is available at www.phila.gov/testing. We also now have a calendar for one-day, we might call them pop-up testing events, which is at www.phila.gov/COVID. So if you want to know what testing new pop-up sites might be occurring in the next few days, the next week or so, you can get it at that website. Now, let me talk a little bit about nursing homes. As you know, nursing homes were hit very hard during the first wave of the epidemic. Half of the city's deaths that have occurred so far have been in nursing home residents. Now, the nursing homes are hit hard enough that overall we estimate about half of the total nursing home residents in the city have had the infection already, and were those that they're likely to be protected against a second wave. That's good for them. Of course, we need to protect the others if we do have a second wave and if we start to see more virus spread in nursing homes. We're working now with the medical centers at Jefferson University, University of Pennsylvania, and Temple University to provide support to nursing homes and infection control to prevent the spread of the coronavirus infection within the nursing home amongst the staff and between the staff and the residents. That support is in the form of staff training on infection control procedures, testing, assistance with providing testing, and personal protective equipment. In addition to that, we are now going to be setting up an alternate care site for nursing home residents that test positive for COVID so that they can be cared for in a place where they're not likely to spread the infection onto others. This would not be for every COVID positive nursing home resident, but for those residents in nursing homes that can't care for them in a way that to prevent the spread to other residents. For example, if a nursing home does not have a separate wing and cannot separate out their staff from the COVID positive residents to the COVID negative residents, this would be a facility where that person could stay during the time when that person is infectious, again, to protect the other residents in the nursing homes. Now, just a few words on vaccine development. Now, a little update on this. There are studies now on the safety and effectiveness occurring in tens of thousands of volunteers in this country and other countries around the world. In the meantime, production has started in the hopes that many of these vaccines that are being tested are going to be proven safe and effective. Right now, there are, by my count, 6 vaccines that have received support from the US government that are either in phase 3 trials, that's the final stage of the studies, or will be in those phase 3 trials by the end of 2020, which means that there's potential for as many as 6 vaccines to be available in the city of Philadelphia by, let's say, April 2021. Now, some of those vaccines likely won't make it through the trials. They'll be either proven to be not safe or proven to be not effective. But some of those likely will. We hope to have small quantities of at least one vaccine for distribution in Philadelphia before the end of 2020. We are now in the process of putting together a plan for how we will distribute the vaccine when it arrives. Now, the plan can only lay out a general approach because much about the vaccine is still unknown. We don't know which vaccine is going to be available first. We don't know for whom it's going to be authorized. It may not, for example, be authorized for people over the age of 65. They haven't tested it in people over the age of 65. We also don't know how many doses per person this vaccine will be recommended for. Some of the vaccines are to be given in 1 dose. Some of these vaccines are given in 2 doses. We also don't know the storage and handling requirements for the vaccine. And the storage and handling of the vaccine really affects how we can distribute the vaccine. Nonetheless, we're hopeful that we will be offering some vaccine again before the end of the year. And initially, we hope to offer it to people who are at very high risk for severe infection, such as nursing home residents, and people who are at very high risk to acquire the infection and then pass it on to those who are themselves at very high risk for serious infection. That would include such as the medical staff at nursing homes or home health aides. Later, as we have more vaccine, we will expand it to other groups. So you'll hear more updates as we get closer to this. At least it's exciting at the point where we're actually getting down to some practical planning. And we may be just weeks away from being able to offer the first vaccine to some people here in Philadelphia. Now to get to the issue of the event limits. Last week, the governor announced new limits on the size of events that are permitted in the Commonwealth of Pennsylvania. Instead of having a fixed limit of no more than 25 persons for an event indoors or 250 persons for an event outdoors, the new governor's limits base the limit on the number of people allowed on the size of the venue. Indoors, the governor's limits would allow hundreds of people, or in very large venues, up to 3,750 people at one event. And outdoors, the governor's limits would allow up to 7,500 people in one event. Now, we have real concerns about this in Philadelphia because this city, this county, has its own unique risks. We have many very large venues. And of all the counties in Philadelphia, we are the hardest hit with COVID, and our case rates are rising right now. So we have reviewed, and we do not feel that this guidance, that these rules is safe in Philadelphia, especially indoors. So we will be more restrictive within the city limits than is allowed by the Commonwealth. However, we will change our event size limits to be, like the governor, have those limits be based on the size of the venue, but with a lower percent of maximum occupancy that is allowed by the governor and a lower absolute cap on the number of people that is allowed by the governor. So here's how it would work out. Indoors, we would allow no more than 10% of the maximum occupancy of the space, not 20% as allowed by the governor. And we would allow up to 250 people, not up to 3,750 people as allowed by the governor. So how would this play out with a couple examples? Let's say you have an indoor theater that has a maximum occupancy of 300 people. That could have 30 persons in that theater. Or a very large indoor sports arena with a maximum occupancy of 10,000. That could have no more than 250 persons. That includes athletes and staff. Now, also note that for most venues that are smaller, this rule is actually more restrictive than the previous rule. So a space that has a maximum occupancy of 150 can host no more than 15 people. This, we hope, will help preventing the problem of social gatherings of 25 people that are occurring in small spaces, which we have seen. And that's the rule indoors. Now, outdoors, we would allow more people because the risk of COVID spread outdoors is substantially less than the risk indoors. So here would be our rules outdoors. If the maximum occupancy is less than 2,000, we would allow 20% of the maximum occupancy. And if the maximum occupancy is greater than 2,000, we would allow 15%, up to a total of 7,500 people. So what does this mean? That means an outdoor stadium with a maximum occupancy of 10,000 can have up to 1,500 persons. That includes the athletes and the staff in that facility. Now, a few other notes on this. There are other safety rules. All other safety rules still apply. At events, everyone still must wear masks, which means we are not allowing food and drink in theaters. Everyone should stay 6 feet apart, and 10 feet is even better indoors. And that means that organizers of events must prevent clustering of people, whether they're in their seats or when they're entering or exiting, or when people go to the bathroom. Another note is that you'll notice that the outdoor limits are substantially greater than the indoor limits. And that's because we believe outdoors there's much lower risk because of the much higher levels of ventilation outdoors than indoors. The point of this design is to encourage everyone, if you want to gather, do it outdoors where it's much safer. Now, the indoor limits also are slightly higher than what we've previously allowed for other routine settings like retail stores and museums and libraries and gyms, which were 5 per 1,000 square feet. We're going to adjust those to 10 persons per 1,000 square feet to match. That 10 persons per 1,000 square feet ends up being approximately 10% of the maximum occupancy. All these rules go into effect this Friday, October 13th. But I want to be very clear here that if any spread occurs at events, or if case rates continue to rise, we may very well restrict these further again. This epidemic continues to change, it continues to surprise us, and if things, especially with the colder weather and the drier weather, if the virus starts spreading more, we may have to go to a much more restrictive mode. Let me remind everybody, though, now that the biggest problem with the spread of COVID is happening not at public events, but at social gatherings, typically amongst close friends and relatives. These are typically small indoor gatherings of 5 to 20 people. So a principle for everyone to think about is that the people most likely to give you COVID are the people you trust, because those are the people that you tend not to wear a mask when you're near them. And so the smaller event limits we've announced today may help limit that a little bit. But still, while those are allowed, we're not recommending these social gatherings of any size. When people get together with their close friends and relatives, that's when spread occurs. The events of greatest concern to us right now are social gatherings like weddings and funerals, bridal showers. People get together, they know each other, they hug and they kiss, they get close together, they don't wear a mask because they don't want to wear a mask for the pictures. That's when the risk is the greatest. And so just want to remind everybody, first of all, follow our safety guidance on our website, wear a mask, especially wearing a mask when you're around your relatives and close friends. And if you have to gather at all with people, we strongly recommend you do it outside. More information, including on our event limits, will be on our website, www.phila.gov/COVID. Thanks.
Thank you, Dr. Farley. We are now going to move to Armando, who will deliver the Spanish language translation of both the Mayor and Dr. Farley's remarks.
Good afternoon. I have a question first for Dr. Farley. Sir, with the case counts rising, with the positivity rate up, can you talk a little bit about what you will be watching for? What specifically would trigger a regression in these openings? Is there a number? Is there a metric that you're looking at?
Looking at case counts among people who are most likely to have severe infections or a fatal infection. So probably people over the age of 60. And I don't have a specific trigger, but that is, if those cases are rising substantially, that says that we're likely to have an increase in deaths, and that's what we care about the most.
And Mr. Mayor, a quick question for you as well. This new guidance doesn't seem to help indoor venues, some of whom are barely hanging on financially. I'm wondering if you have any message for those business owners about their future.
It's a very difficult situation. Again, everything we've done since the beginning of this pandemic has been based in science and medicine. Despite the fact that we'd like to be more easygoing with the indoor events. The indoor events are where people get sick. While I recognize they are hanging on, we're going to do our best with the case counts to make sure we can get them more people that are allowed in their facilities. But we cannot in good conscience put people in a facility we know is going to give them more of a chance of getting sick.
And one last question. I don't know who best to address this, but I'm curious how alcohol sales and concessions would work at an outdoor venue, and also access to parking lots and stadiums on game days. I know you've been restrictive in the past, but for people who have tickets, for people who don't have tickets, what would they need to know?
I'm not sure. I think the Eagles are still working on their operational plans. There won't be tailgating allowed. I assume they're going to have to present a ticket while they drive into the facility. The Eagles, one thing I do know about the Eagles is they're very precise when it comes to following a plan, and they will have sufficient personnel and very strict rules when it comes to masks and no tailgating. Doc, if you want to add something on the concessions, I'm not aware.
Just say, according to the governor's rules, alcohol can be sold in the context of a meal. We just follow the governor's rules on that.
So if you bought a beer at the link, you'd have to buy a hot dog too or something?
Yes. And now whether you have to have a beer or the hot dog at the same time, I don't know.
Okay. Thank you, guys.
Thanks, Mitch. We're going to go now to Jeff Cole of Fox 29.
All right, here we go. For Dr. Farley. Dr. Farley, I want to make sure I'm a reporter, so that of course means that I'm terrible in math. I want to make sure the link holds about 69,000 fans. You will allow no more than 7,500 fans inside the link this coming Sunday, and that includes the players and the staff on each team, plus the referees. Is that correct?
And no more than 7,500 people, not no more than 7,500 fans. So that's total people, including the athletes and all the support staff, of which there may be 1,500 people. So the number of fans will be somewhat less than that. Yes, we would allow that number at the link.
Doctor, obviously the link is a massive venue that holds, 69,000 people. What makes you believe that there can't be more people than that and still be able to distance them and wear a mask? It seems like the move is to make folks feel better about fighting COVID, but not necessarily to allow all that many folks in to watch the game.
Well, first of all, that 7,500 limit is the governor's limit as well. So we cannot be more liberal than the governor. So even if we wanted to, but also I think that limit is reasonable. That there's a number of empty seats there, but still 7,500 people provides some opportunities for people to get close together when they're entering or exiting, or when they're at the concession stands or in the bathrooms. So having some limit so that it's pretty sparse within the stadium makes a lot of sense.
And then if you happen to watch the game Sunday and you see fans climbing all over each other without masks, and it looks to you like it's more than, 5,500 fans in there, what are you going to do? Would you fine the Eagles in some way if they don't watch this aggressively?
As I said earlier, Eagles are extremely capable of following the rules. They're sticklers when it comes to these kinds of things, and I have every faith that the Eagles organization will make people wear masks. We'll make sure that they're monitored wearing masks and tell people to put their masks on. They will spread out the fans appropriately, and they will do all the things that we need them to do to make this work. It's in the Eagles' best interest to have this go off without a hitch, and I'm confident they can do that and will do that.
But Mayor, certainly we've seen, as we've watched games in other cities, where it sort of starts folks with masks on, and then as it gets rolling, everybody seems to get together and the masks drop below their chins.
Well, we'll see what happens, but I have every confidence in the Eagles organization to carry this out.
Thank you.
If I may add, if people are intending on going to the game, bring a mask and expect you're going to have to wear a mask throughout the game. The Eagles are going to be enforcing that, so everybody who goes there ought to know that that's part of the rules.
And they're going to cordon off part of this stadium. They're going to take places and say, you can't go in there.
They are going to zip tie off seats so that you can only sit in the seats where you have your tickets. And that leaves plenty of space around different household groups so that they're very far from each other.
And I don't know whether or not they're going to mimic the Pittsburgh stadium, Heinz Field, but I think the upper bowl was closed in Heinz Field. When I watched the game on Sunday, I didn't see any fans in the upper bowl.
You think this will help them play better, Mayor?
I hope so.
Thank you.
We're in first place right now, though.
Okay, thank you. Just a reminder of the 3-question limit. We're going to go to Laura McChrystal of the Inquirer.
Hi. Just a question. Has the city been in touch with Temple? I believe their football team has a game on Saturday. Would they have fans there?
The city has been in touch with Temple. We have authorized them to use the stadium. We have just announced these event limits now. We have not had a discussion with them about the effect of the change event limits on their football game this weekend. But according to the limits, they could be allowed to have a limited number of fans in the stadium on Saturday.
Okay. And a question for Mayor Kenny. Do you personally plan to attend the Eagles either this weekend or upcoming?
No, I'll be very happy to sit at home and watch on the big screen with all my food and beverages. I know if I went to a game, somebody would take my picture and it would become fodder for social media. So I will stay home.
Okay. And lastly, a question for Dr. Farley. With the increases in cases, could you give us a sense of, like in the last week, that average case count, that is the highest since when? I know, like, for example, the state on Saturday had the highest daily count since April.
Yeah, I think it's the highest since sometime in July, but you do also need to take into account that we're doing a lot more testing than we were then. I believe in the last week, we're testing about 3,500 people a day, which is a good bit higher than we were before. I'll have to check and I can get you an exact number on that.
Thank you.
Thank you, Laura. We're going to go now to Maggie Kent of 6ABC.
Hi, guys. So my question is in regards to schools. I understand that we were hoping to go back to a hybrid model in mid-November. I wanted to ask Dr. Farley, are we still on track for that? What is the assessment? How are you assessing if we still remain on track?
Yeah, the decision about whether the schools offer in-person education is going to be the school district. It's not the health department's decision. However, the health department has said that we think that they can do it safely. And we've advised them on what the protocols could be, safety procedures. And we do have the examples of the parochial schools that are open and with in-person education and are not being spread within their buildings. So I'm hopeful that they will open, but you really need to talk to the school district about their specific plans.
Got it. That's it. Thank you.
Thanks, Maggie. We're going to go to Martin Pratt of Philly, Your Black News.
Yes, this question is for Dr. Farley. And how is the city planning to respond to what we perceive may be an increase in cases? Will we be alerted through press releases? If it's not on Tuesday, obviously. And what type of, is there a crisis response team standing by or,
Well, we are seeing increasing cases over the past couple of weeks. We put out a press release every weekday so people can follow that. And we have the graph on our website that shows the overall trend. All I can say is that we are responding the best we can and adjusting as we can. I can't say what sort of actions we'll take in the future if things continue to get worse, but we will try to respond if we feel like there's substantial increases.
And your comfort level with outside events, we've seen the president cause a super spreader event, and we've seen these events at rallies where people were definitely affected. What gives you a sense of peace that Philly doesn't have that same issue when you're increasing the amount of people outside events, specifically events, not restaurants or businesses?
We have not seen reports where we're convinced that a spread has occurred outdoors. And if you may remember that we had large protests here in, I believe it was April, the George Floyd protests. We had thousands of people on the streets and no evidence that increased our spread of COVID at all. Now, we do recommend that even outdoors, people wear masks. That's extremely important. If people are standing next to each other outdoors, they can clearly spread the virus from one person to another if they're not wearing masks. But if they're outdoors wearing masks, we think the risk is pretty low. And I would much rather have people outdoors wearing masks than indoors at a gathering of 15 people not wearing masks.
Thank you. That was it.
Thank you, Martin. We're going to move to our second round of questions now, and we're going to start with Rosemary Connors of NBC 10.
Hey guys, can you hear me?
Yes.
Okay, great. So I have a question. This is either for Dr. Farley or the mayor. I actually just got off the phone with the head of the Greater Philadelphia Hotel Association, who's crunching the numbers as we all are. And from what he's observing and sort of what I'm observing too, from my understanding, the previous limit on indoor gatherings was 25 people. But now, for example, if you have a space that holds up to 500 or rather 50, like a conference room, which a lot of hotels have, you can do only 10% of that. So that's 5 people. So his interpretation is that this could actually hurt in terms of limiting or limit even more what they were able to previously do, right? If you were able to do 25 for an indoor gathering previously, but now if you're doing the percentages and say, for example, your space can hold 50, like a conference room, you're limited now to 10% of that, so 5. So either Dr. So one, is that are we interpreting this correctly? And 2, can you comment on it?
Yes, you are interpreting that correctly. For the smaller spaces, these limits would be tighter limits than what we currently have. And we do think we are seeing spread in these small gatherings. And so I would simply recommend that hotels use the very larger rooms to have the gatherings. If they want to have 25 people in a much larger room, that's still possible. They could have a gathering of 50 people in a very large room. That's safer than having 25 people in a small room.
Okay. Mayor Kenny, do you want to chime in on that at all? I mean, let me put it this way. The language that I was given was that this would hurt them, I suppose, in part because they want to try to make the most use of their spaces for revenue purposes. So to try to put...
We're not trying to hurt. We're not trying to hurt anyone. We're trying to keep people from getting sick and dying.
Great. Thank you, guys.
Thank you, Rosemary. We are going to go now to Jack Tomsick with Metro.
Hello, this question's for Dr. Farley. Regarding the nursing homes and that, alternate facility for people who test positive, they can't be isolated. Do you have a timeline and location of where that's going to be?
We hope to have that within the next week. And I'm not sure I want to tell you exactly where it is just because I don't want people poking around there, but we'll look into that.
Okay. And any idea of when it would, begin operating?
Again, sometime in the next week.
Sometime. Okay, sorry. And with the South Philadelphia and far Northeast numbers going up, has the contact tracing team of the health department figured out perhaps why that's occurring?
They are talking to people every day, and all I can say is they're continuing to hear about small social gatherings and household transmission. I don't know why that would be more reported in far Northeast or in South Philly than in other neighborhoods, but that's what we're hearing.
Okay, thanks.
Thanks, Jack. We're going to go to Pat Loeb of KYW News Radio. Pat, you're unmuted there.
I wanted to get an update on restaurant compliance, especially we've heard people are being seated at bars in some restaurants with small capacity, and I believe that's against the recommendations. Is there any enforcement of that going on?
There are 2 different teams that are doing education and enforcement at restaurants. One team is actually just going out there doing education only. They're letting them know what the rules are. They do report back to us in general whether the restaurants are in compliance. And there's another team of inspectors that do an inspection that would lead to sanctions if they were out of compliance. I can tell you the education team is finding that more than 95% of restaurants are in good compliance. So overall, we think compliance is good. We're going to continue to monitor that. But bar seating is not allowed. If anybody knows a place that is doing bar seating or is out of compliance in any other way, they should call 311 and we can send an inspector out to respond to that complaint.
Hey, Doc, correct me if I'm wrong, but I think some of the bar seating that I've seen is that they have a high top against the bar and the patrons are facing each other, not facing the bartender. And I don't know whether or not that's in violation or not. But I've been seeing people sitting at a bar stool facing the bartender, but simply parallel to the bartender.
To be honest, I don't know myself whether we're allowing that. I'll check and.
I've seen it. I don't know whether it's legal or not.
Okay, this question is for Dr. Farley. With regards to the alternate care site for nursing home residents at places where they can't separate them, do we have an idea of what the discharge policy would be for that alternate site?
I'm not sure what you mean as far as discharge policy. They would stay there during the period when we think they might be infectious, so that they would not be bringing the infection and passing it on to what might be roommates at their regular facility. Now, the period for that typically is for somebody who's, say, been hospitalized, I believe is 20 days after they have the onset of symptoms.
Okay, got it. Thank you.
Okay, thanks, Alan. We are going to move now to Denise Clay of the Sunday Sun.
Good afternoon, everybody. My question concerns the gathering, the gathering place numbers. If someone has already put down a deposit, or I guess, what are you telling people who have already planned gatherings, particularly at the smaller places that have been cut down even further? What are you advising them to do? Can they be grandfathered in, or do they have, or are you now down from being able to have 20 people at your very small wedding to now only having 3 people?
Well, I would recommend that people have their weddings outside. The weddings are things that we worry about a lot. You know, we've always said when people have asked, you know, can I have my wedding a month from now or 6 months from now, we say we cannot predict the future. We cannot guarantee that you're going to be able to use this facility for that purpose at that time. So I would suggest that they try to find a way to have it be within our guidelines and safe.
Okay, but and I'm asking this as much for the people who are on this, who are you know, Philadelphians that are going to be, you know, that are not me, as I am for me, because my wedding is in January. And
it's the same answer whether it's your wedding or anybody else's wedding.
Okay, well, no, that's,
and they're for safety.
Well, no, and I understand that, but you have a lot of people in my situation who are going to have to make some more changes because of this. And is that fair?
That is safe, and it's my job to protect safety.
Okay, thank you.
Thanks, Denise. We are going to move now to Max Marin of Billy Penn, WHYY.
Hi, thank you so much. Dr. Farley, just a quick clarification on a stat you mentioned earlier. Did you say more than half of all of the city's residential congregate care setting people living in the city's nursing homes have already had the virus? And could you elaborate on that number?
Yeah, so let me explain where that number comes from. We took all of the cases that were reported in nursing home residents, cumulatively since the beginning of the epidemic. And then we got an estimate of the number of people living in those nursing homes and divided one by the other, and ended up being a little more than 50%. Now, we recognize that the nursing home population turns over, and so that 50% is a high side estimate. But I would say then approximately half of the people who are staying over the long term in these nursing homes have had this infection, which in a way is good because it means a lot of these people now have antibody, are likely to not get infected should a second wave occur. But there also has been turnover. And then there are, you know, roughly at least half people who do not have had the infection, so they'd be susceptible.